I'm here with Leo, and we did acoustic wave therapy on his leg. He had some advanced lymphedema. And acoustic wave therapy is a device that sends shock waves or energy pressure points into the skin, and it causes neovascularization or new vascularization, in this case lymphatic growth. It's been proven in clinical studies to grow lymphatic tissues back. We're doing a trial with our patients to see how much swelling will reduce after treating their what's called lymphedema or varicose vein-related lymphedema. And you had how many treatments?
I believe this is my third treatment.
Mm-hmm.
Okay, can you describe like what it feels like for the patient?
Well, it feels like something like going over like with a rolling pin. There's a vibration. It feels good. You can feel that your skin, your muscles are loosening up as the procedure's going on.
How would you describe like a discomfort? People say, does it hurt? How would you answer that?
After the third session here, the pain is actually less. I guess maybe because the muscles have gotten used to it. The pain is tolerable.
Okay, and that's where you really can go up. We were talking about this earlier. So the way we do the settings, that's a question that the MAs ask, and since I'm doing this to try to figure out what's the best energy, it is a work in progress. But here's the basic factors of the acoustic wave. You've got an energy bar, B-A-R-R, that's how hard it's punching. Okay, more bars, more punch. If you're going over bone, a high bar would hurt because it can be hitting the bone. If you're going over like a belly, it doesn't really hurt much. So softer tissues can handle more bars. And he said it's hurting less because his skin is not as dense now. He's actually healing. So you might increase the bars in to give him a little more oomph. Then there's the hurts. That's how fast it's going. And I asked the patient, you want to get this over with quickly? And it hurts a little more, or you want it to kind of be more gentle and go slower? And they decide, a lot of times they'll say, just get it over with. So that's a higher hertz.
Mm-hmm.
So we wanted to do the bars to their tolerance and then speed up the hertz to whatever's convenient for the both of you. Then the last thing that determines the energy is the shape of the tip. So these tips are interchangeable. You can screw it off and put on a new one. A wider tip is going to make less energy per centimeter because you're putting the same amount of force onto a bigger ball. And a tip that's got rounded shoulders, there's tips that have a rounded shoulder, and that actually disperses the energy out wider. So that's really not what we're using. We're using the most aggressive tip, which is a small, the gold one. It's got sharp edges and it's relatively small, so it sends a lot of energy down the tissue. So when setting the energies, if you have a question, you can ask me, but a lot of times you can just determine it based on what the patient can tolerate. If you push on their skin and it's very firm, they're not going to tolerate a lot of bar because their skin's too firm. So you might turn it down to a 2 or 3 and start out and increase it. Once they say, yeah, this feels a lot better, then you can start increasing it. And eventually you might get up to the maximum bar and the maximum hertz. And what we're trying to do is stimulate new lymphatic growth to clear away, because theoretically this lymphedema, the idea is it's a chronic condition, it never goes away, but we've treated people and made it go away. So I just want to kind of standardize the system for doing that. So thank you very much. And then we'll do a video of you